Hi, we just got an order for Ivy Armstrong, the Emperor in G2. I've verified that my supplies are not expired and within date, so we are going to go ahead and go in the patient's room. Hi, Ivy, I'm Amanda. I'm going to be your nurse.
Hi, Amanda.
We're going to do the NG2
Ivy, the next thing I'm going to do is going to seem kind of
What's that?
but it is going to help us with the procedure.
It's the
I am going to check your
here. I'm
gag
going to have to put
reflex.
it
We do want you to have
through
one
your
in order
nose
for us
and
to
it'll
proceed
go
with
down
the
your mouth
procedure.
to provide you some nutrition during your bowel obstruction.
That sounds gross.
Yeah, it's not fun, but hopefully we can get it done quick and you'll be feeling better with some nutrition inside of you.
I hope so.
Is it okay if I send myself on your bed?
Yeah.
Alright, and I'm just going to go in on 3, 2, 1, checking that reflex.
Can't forget the hand hygiene.
Oh, yes. Very important.
Okay, Ivy, with that, I'm going to go ahead and prepare the tubing. So you're going to grab some tape and we'll need that a little
Have you
bit
ever
later
had
on in
an
the
NG
procedure.
tube before?
No, I haven't. Thankfully. They sound uncomfortable, but...
Yeah, they're a little uncomfortable, but it's pretty quick. Before I get started, do you have any history of a nosebleed, any sort of nasal trauma, or deviated septum?
No, not that I'm aware of, so probably not.
Okay, good. While I'm doing this, can you verify your full name and date of birth?
Yeah, it's Ivy Armstrong, 3964.
Okay, and do you have any allergies?
Just latex.
And can you tell me what month and year it is?
February, right? Yeah, we just had Valentine's Day, so February.
Put the tube in through your nose. You should be able to feel it in your throat. At that point, I'm going to assess to make sure it's there. Then I'm going to have you help me swallow the tube down into your stomach, okay? Okay, great. Should I tell you when it's going in? I should? All right, I will let you know. All right, can you tilt your head back for me? Straight back, very good.
You hanging in there?
All right,
Ivy?
3, 2, 1.
Yep.
Okay, and so generally we would, when we put this tube down, we would have you swallow some water to help the tube go down, but unfortunately you're NPO, which means you can't have any liquids or anything.
That's annoying.
Yeah.
You know what, I'm going to pull it out just a second. I will make sure I'm able to mark
Okay, I'm
this
gonna
for
raise you up.
Woohoo!
Do you like roller coasters?
Yeah. Actually, no.
No.
No. Not a huge fan.
Why not?
I don't know, they just scare me. I hate heights. I'm worried that they're gonna fall.
Sorry about that. I know that.
Or that I'm gonna fall.
Kind of traumatizing to have that thing more than once. All right, once again, I'll tell you 3, 2, 1, going in. You're doing well. Yep, I see it right back there behind your uvula. So now what I'm going to have you do is tilt your head down and help me swallow that tube.
I'm going to take a look in your mouth and your nose. So first, I'm going to include one of your nostrils and tell me if you have any difficulty breathing in either side, okay?
Okay.
I want to make sure that we have it placed properly. That's on your side.
Was there one side that was clearer than the other?
No, they both felt pretty equal.
Go ahead and pierce a little bit.
And any issues with your mouth recently?
Nope, all good.
Okay, very good. And before we get started, I just wanted to show you what the tube looks like.
That thing is long. Is it all going inside of me?
No. In a minute we'll measure it, and it'll probably go to like right here, somewhere around there.
Okay.
But real quick, I am going to expose your abdomen so I can listen to your bowel
All right.
sounds.
pH is
Okay.
3 IV, so we can continue. That's what we want to
You
see.
should have been closed the whole time.
It's okay. Those curtains are kind of annoying. They're such an ugly color.
You're going to go
really
ahead and remove that tape off your cheek. We're going to tape it tube down
And let me know if you feel any
With the
tenderness or
tape
pain when
on
I'm
your nose.
pressing down a little bit.
Okay. You are pressing down a little hard. It kind of hurts, but
Okay.
I'll survive.
All right, IV. And then we're going to send you down to X-ray to make sure everything checks out. Do you have any questions before we send you down to X-ray? No? Okay. See you once you're going back down from X-ray. At this point, I would drop the patient's head. Patient would go to X-ray. Patient back up, and then they come back in the room. All right, Ivy. So we confirmed placement for you there in X-ray. Now we're going to get you hooked up to suction. It's going to help to suction some of those contents out of your stomach. That should help with the symptoms you've been having.
Oh, nurses and their tape. They always have so much of it.
Yeah, it's almost like they got to take things back together.
That was a good one.
It's been a long day.
Is that the one we just did?
Right, Ivy. Going
Is this your
intermittent.
first nasogastric tube?
Yeah, I think you asked me that already.
Bringing up the suction. Suction.
I don't like them already.
Yeah, no one
Right,
really
Ivy.
likes them.
That-
Have you had one before?
Okay, you're still
Only one.
okay. Right.
How was it? Was it terrible? Give it to me straight.
We're just gonna bring your bed down.
It
I
wasn't
will
too
have
bad.
to
It
keep
was a
the head
little
of the
hard at
bed
first, but I mean, I was also little.
45
So.
degrees or higher.
Yeah, that
So
makes
if you drop it
sense.
back a little bit, but because of that too, we'll have to
So
keep it up.
I'm gonna practice some things.
Now we're going to measure.
Drop it back a little bit, be a little bit more comfortable. Here we go. All right. I'm gonna make sure that your call light is within reach.
Xiphoid process.
Pull back our curtain. All right, Ivy, I'm gonna come check back on you in about half an hour. Is there anything else I can do for you in the meantime? No? Okay, well, you can call me if you need anything, okay? All right, thank you.
What are you doing now?
I'm just taping it so I know where
Clean up the workstation.
we have to put the tube in, how far we have to put it.
Oh, that's nifty.
Yeah. So it kind of provides us a little hint.
Yeah, makes sense.
I have a list of
Everything went well, just set somewhere with that too. And stethoscope.
And we're going to put this towel on you just because you may have to warm it during this process. So
You're telling me this is gonna make me throw up more than I already am?
initially, yes.
Ugh,
After
gross.
I'm going to, real quick, if you would open up, I'm going to poke your uvula, which is your gag reflex, just to make sure it's intact before.
Blech.
Okay, very good.
Well, can we finish that?
NG tube
But
line.
it goes to your files.
If for any reason during this you're having trouble breathing, you are in pain, you need me to stop, just raise your right hand or your left hand, and I'll stop. Okay?
So say we have IV, and we're probably gonna have IV push.
Okay.
Are you ready?
Yeah.
It doesn't, I mean, it's not even an actual.
Like it's not gonna be three crazy. It becomes like a.
It's not connected to anything. It's just connected right there. Yeah.
Hey.
I press it in 3. It's straight
Looks like it's down there.
No. Don't push the button. Don't push the button.
What?
Are you doing okay, Ivy?
Yeah. Just feels weird.
Yeah.
You're next up. How you feeling? You're gonna figure it out. Yeah. At least that's what it is.
Okay.
You might want to grab some new strips. I know
In
this
real
stuff-
life, we would go down to this tape, but it doesn't seem like it was wanting to go down that far,
So we're
so
just gonna throw those out.
we got relatively close. And we'll just stop here. We'll take this tape sheet temporarily.
For you. Alright.
And now we're going to aspirate a little bit just to ensure we are in your stomach and not somewhere else. Okay?
Okay.
Which ones do people usually fail?
Okay, and we'll take some of your stomach acid. And it looks like it's about a 4, which is right where we want to be. Okay, good news, Vicky. Your NG2 is in your stomach, so we just got to send you out for a quick x-ray to confirm that everything's squared away. Do you have any questions for me?
It feels like it's kind of fallen off. Can we tape it more?
Yeah. This tape isn't very adhesive, so I apologize about that.
Well, what if you put another piece of tape on it?
That'd be helpful.
Give me PPE, please.
Is that better?
Yeah, that feels a little bit better.
Okay. Now we'll send you off for your x-ray, and I'll see you when you get back.
Okay.
Hi, Ivy. How was your x-ray?
It was super cool.
That's good. The x-ray came back good. NG's tubes in the right place. And now we're going to do some suctioning.
So I'm just figuring out like what time we have to come in and what time.
Here, I'll start this one. Check over everything that we
So if we're at 8 o'clock, we have to stay till 12.
I checked my orders and I've gotten all my. Now I'm gonna go in and check on the pictures. Hey, Ivy.
Sign up for that later.
Okay, and you'll feel some slight pressure.
I'm
It's
here
going to
fix
suck
an
a
NG too.
or
I've heard you have
suction for a
problems
little
with
bit and then it'll stop.
bowel obstruction. Could you please confirm your name and date of birth?
So like you
Heidi
get ring
Armstrong.
if you're early.
Okay. Yeah. That one date. Do you have any allergies? Latex. Okay, good to know. No.
Open lab is for other, like other divisions.
Oh, this goes to everybody,
No.
so they're not
It's
checking out.
gonna be a bit uncomfortable.
Lubricated the tip. And it's for, it's not just for.
We do this well, it should be fine.
Like, you're an adult health.
Anybody, you got
Now,
it.
if you have any questions, let me know.
Very good. Get that taken care of.
First, I'm gonna start off by assessing.
You have your call light,
Ivy,
Ivy.
do you know what date it is?
And did you want me to deliver your bed?
Do you know where
Maybe
you
a little bit, but not too much.
Okay.
Do you know what month? No, it's not April, but you know what? You're close enough.
Is that good?
Maybe a little more. I feel like my tube's falling out.
Check some things.
It should be. You're all good. The X-ray showed.
Okay.
Show me how to. I always mess that up. I always tell me how to.
I realized you were a bit too early.
And you got your call light. Is there anything else you need before I leave?
No, I think we're good.
Okay, I'm just gonna get my stuff cleaned up and use your call light if you need me.
Okay. Sounds good.
Okay, looks good. Now I'm gonna.
In real life, you would be throwing these away.
Now I'm gonna have you blow. Okay, great, thanks. Now I'm just gonna cover one of your nostrils and I'm gonna have you blow out through the other one. Okay, perfect. Okay, good. Now, Ivy, I want to test your gag reflex, make sure we can do this.
For pretending this is still in, because I wasn't supposed to take it out yet.
3, 2, 1.
Make sure it's taken. We're talking about.
No, that's
So when you come back, you put that up there, give them two.
No, Ivy, I'm just gonna have to uncover you a bit here, and we're gonna check out your abdomen. That's supposed to be. No abnormalities. Anybody obstruction? Sounds like. Here we go again. Now, Ivy, we're going to be placing in this NG2. It's going to be a bit uncomfortable.
Sure you didn't put back the wrong one.
I'm going to need you to work with
Throw
me.
back the one that you used. That was yours.
Okay, and now we're just going to wipe off this end table.
Things on your pads.
Pretending the curtain's still closed for Ivy.
So like this patient,
Now, I'm going to measure to see how far we're going to place this NG2. Okay? So this might take a little bit.
that way I'm right.
No, And now I'm going to go document that we put a NG tube in Ivy Armstrong, and I did forget to mention my hand hygiene, so we will also do that as well.